Good afternoon, everyone. I'm Laura Lefevre and the Community Projects Director here at the Children's Center. We will begin our 1-hour listening session in just a few minutes. But first, I want to point out a few housekeeping things that will enhance your time with us. You're currently viewing this listening session in Zoom webinar mode, which means that during the presentation portion, the mics and the cameras are off. It is our intention that once the presentation has been completed, then we're going to move everyone over so that your mics and cameras can be turned on, because we want this to be an interactive experience. One of the things that I do want to point out, in the upper right-hand corner of your screen gives you the opportunity to view this presentation in gallery mode, which will allow you to see the panelist as well as the slide presentation, or you can view in single screen mode. During the presentation, you're going to formulate plenty of questions, and as soon as we finish the presentation, we'll go into questions and answers, and at that time the chat box will be open. So please feel free to start populating your questions, but with your mics and cameras on, we will also have the opportunity to have some interactive questioning go on. Finally, as we begin to, after the question and answers, and we'll go into transitioning to our final comments. And at that time, you will find in the chat box a link to a survey. We're always looking for continuous program improvement for this imperative. And so please, we'd love for you to take the time to click that link and to provide us feedback. Now, with the housekeeping out the way, I'd like to introduce you to today's presenters. We have Regina Jemison, attorney and counselor of law and faith, and a member of the Children's Center Program Operations Committee. Deborah Matthews, our president and CEO at the Children's Center. Carlin Nichols, who is our chief clinical officer at the Children's Center. George Nguyen, our chief operations officer at the Children's Center. And Kevin Fisher, executive director of NAMI Michigan. Thank you for your time this afternoon. And now on to our listening session for Crisis to Connection, an imperative for our Black boys. Thank you.
Thank you, Laura. Welcome, welcome, welcome to our conversation for the Crisis to Connection imperative for our Black boys. Again, my name is Regina D. Jemison, and I do serve on the Programs Committee for the Children's Center Board. And as a private practitioner, lawyer, and ordained Christian minister, I have been a legal advocate and spiritual guide for those living with mental illness for over 27 years. Today, we are here for an hour conversation where we will give you an overview of the Crisis to Connection imperative. And in creating this project, we asked ourselves this question: who do we need in this conversation to move our Black boys from a state of crisis to a state of connection? More specifically, we can restate the question this way: who do we need in this conversation so that systems and structures can be changed for our Black boys to live their dreams? We believe you are the answer to this question. In this 1-hour conversation, we will give you an overview of what our imperative is and how it came into being, and why we want you to participate. Again, feel free at any time to type a question in our chat section or click on Q&A. Let's get right into our conversation, and I'm going to turn you over to the Children's Center Chief Executive Officer, Deborah Matthews.
Oh, Deborah, we just need you to turn your mic on.
Good afternoon. Thank you, Regina. I appreciate all who've joined us today for this important conversation about a crisis that's affecting our Metro Detroit communities and beyond. As president and CEO of the Children's Center now for more than 15 years, it's my great pleasure to lead this 90-year-old organization in addressing this imperative for our Black boys. I'm actually a mother of a 42-year-old Black boy who's been challenged with attention deficit hyperactivity disorder, ADHD, for his entire life. And I've seen the negative impacts of this condition and how it's affected his confidence and how it's hindered his success. As the Children's Center works towards solutions, it's critically important that we hear your voices, the voices of our community, the voices of parents, family, friends, mentors, and other people who are people of influence in the lives of our Black boys. The Children's Center mission is to help children and families shape their own futures. Our programs strive for this goal every single day. And as we do our work, we witness the reality of systematic racism that affects and certainly works against the precious children and youth that we serve. These children are afraid, they're angry. And until these barriers are broken down and destroyed, actually destroyed, our Black boys will not see themselves as even having a bright future. So to that end, the Children's Center is willing to look beyond what's been our normal, comfortable practice in behavioral health and child welfare and develop improved strategies to advance the lives of our Black boys so they can truly dream again and lead productive, enriched lives. But it's not going to be easy. It's going to take all of us to accomplish this goal. There is tons of work to do, lots of things that we must focus on. So I welcome you to this conversation. This is just the beginning, and we appreciate your willingness to hear us and to begin to strategize with us. So please think about who else you might want in this conversation, because we're just at the beginning and we're going to continue. At this point, I'm going to turn it over to the Children's Center Chief Clinical Officer, Carlin Nichols. Thank you so much.
Thank you, Deborah, for that overview of the Children's Center. You know, the Children's Center, like Deborah said, has been serving children for the better part of 90 years. And with the focus of ensuring that children and families can shape their own future, we were challenged a few years ago, about 2.5 years, almost 3 years now, to really take a look at who we are for our community and those we serve. So we dug in to really look at who is our client population, who is our primary client here at the Children's Center. And what we found is that our client profile yielded the following: an African-American boy, early school age, 11 to 12 years old, diagnosed primarily with ADHD, attention deficit hyperactivity disorder, and secondarily ODD, oppositional defiant disorder. So this information in hand caused us to ask this simple question to ourselves: what are we doing to meet the needs of this particular child? If this is our primary child, what are we doing to meet the unique needs of early school age Black boys? And so we dug in to get a sense of what should we be doing as an organization that prides itself primarily on providing behavioral health services in an evidence-informed way. We went to the data. What was being done? And what we found was African-American boys are disproportionately diagnosed with ADHD. And as we dug into a little bit more of what the data said, one of the reasons that this is going on is because there is misdiagnosed or undiagnosed trauma. Not just the trauma related to adverse childhood experiences, but also intergenerational trauma. So this historical and intergenerational trauma has yielded particular behaviors that are being seen as symptoms of ADHD. And as a result, we see misdiagnosis or overdiagnosis of ADHD in this particular population. And one of the other things we began to look at is, so if we really want to impact the lives of these boys, how do we do so? And we know as an organization, it is very important that we engage the community in this conversation, because as a public mental health provider, these are children who are engaged in systems and services and providers across the county. So we knew that if we looked at the trajectory of a life of a boy, that we indeed needed to be more thoughtful about not just how we're trauma informed in our method of addressing intergenerational trauma, but also how our partners are also trauma informed in their practice. So as we begin to look at the data, we found that the median income of Black boys in our community is $29,000. Unemployment rate for our Black community, $11,000, 11%, I'm sorry. Infant mortality rate, 3 times the white residents, and the poverty at 35%. And this is just the tip of the iceberg of the data we found. The challenge that we know that we have, though, is we want to impact the lives of Black boys and want Black boys to live their dreams. We cannot do it alone, because our partners engage these young boys just as much as we do. So to share more about what we learned about the impact of not just systemic racism, but trauma, I'm going to hand it off to our Chief Operations Officer, George Nguyen.
Thank you, Carlin. Good afternoon. My name is George Nguyen, and I'm the Chief Operations Officer here at the Children's Center. And I'm the co-chair for the Crisis to Connection and Imperative for our Black boys. Carlin, thank you for sharing with everyone our journey with how we got here today. As stated earlier, our Black boys are in crisis. We know this because the Children's Center has been working with Black boys and children in Detroit-Wayne County for over 90 years. And as you said, Carlin, these youth have been traumatized. So let me take you on a journey. And let me take you on that journey. And it involves the tale of actually 2 zip codes. One zip code will describe children in zip code 48224 on the east side of Detroit. The other zip code will describe people living in 48236 in Grosse Pointe, just 1 block away. 97% of children in 48224 identify as Black, compared to 10% of children in 48236. 56% of the children from 48224 live in poverty, compared to 5.2% of children in 48236, just 1 block away. 4.4% of 3rd graders from 48224 are proficient in English, language, and arts, as compared to 82.5% of 3rd graders just 1 block away. Now that's alarming. I want to repeat that because that is so critical. 4.4% of 3rd graders from 48224 are proficient in English, language, and arts, compared to 82% of kids living 1 block away. This is critical because 3rd grade reading proficiency data is a predictor of high school graduation achievement and feeds directly into the school to prison pipeline. Without effective trauma-informed interventions, Black boys in Detroit, Wayne County are more likely to receive in-school suspensions, out-of-school suspensions, and expulsions. they're more likely not to graduate from high school and more likely to be incarcerated. Again, I tell you, these are not bad boys. I tell you, they are just traumatized. As we move into thinking about our outcomes, we looked at our outcomes from two different levels. The first level we looked at was from an individual level. And from an individual lens, we know our Black boys are overrepresented in the number of school and out of school suspensions and expulsions. Our Black boys are overrepresented in the number of juvenile arrests. Our Black boys are underrepresented in the number of students enrolling in post-secondary education and vocational school. Yes, our Black boys have poor physical and mental health outcomes compared to other races. You see, and from a systems level, simply put, it is our vision to shift the perception of Black males so that the Black boys can live their dreams and stop just surviving. To accomplish this, it's not going to be easy at all. But I believe every one of our Black boys has the right to a home filled with the love and hope and where good dreams begin. Every one of our Black boys, I believe, has the right to grow up in a family which has access to supports necessary to care properly for them, free of poverty and stress. I believe every Black boy has the right to grow up in a family with adequate income and secure in the knowledge that there will be a roof over their head and healthy food on the table. Every Black boy has the right to be enrolled in the healthcare system and receive quality healthcare. I believe every Black boy has the right to grow up in a drug-free environment and a safe community to play. You see, I truly believe that every Black boy has the right to achieve academically, regardless of income or family background, and the right to a quality education in a public school setting. Every Black boy has the right to obtain mental health services to help them address their individual needs. I believe that the juvenile and correction system will not be thriving business built on a projection of failure for our Black boys. I believe every Black boy will grow up being the amazing young person they were born to be. Yes,
We may be experiencing just a few internet issues. And so, Carlin, we're going to pass the mic back to you.
Sure. So one of the focus of this particular imperative is really engaging our systems partners and stakeholders across the county who have a specific focus on working with children and really do believe in ensuring that Black boys live their dreams and see the value of Black boys growing into strong Black men. And the outcomes that George was sharing with you really do speak to us as a body coming together to create change specifically so that Black boys can live their dreams. So our goal would be to decrease the barriers, to ensure trauma-informed practices, do it in a collaborative way, all by ensuring we have a number of initiatives that would address issues of implicit bias and systemic racism in the Wayne County community. So our focus in Crisis to Connection is if we make the connection, those of us here working together to ensure that Black boys can live their dreams. If you could move to the next slide. If we work together, we'll be able to address the trauma, the systemic racism, the implicit bias, the poverty, and the intergenerational trauma, which is the crisis that our CEO, Deborah Matthews, spoke about when she first came to the screen to share this idea with you all. So I'm going to pass it on about how you can partner with us.
Thank you, Carlin. All right, everyone. And please, everyone, bear with us. We know that we've had some storm issues today. And of course, as we are virtual, storms aren't friendly to the internet connections. And so Mr. Nguyen will be joining us back shortly. So we are going to get ready to go into our question and answer portion of this discussion. And I know many of you have questions, so we are going to work to get you switched over so that you can ask live questions, but also we want you to ask questions in the chat or the Q&A so that everyone can engage. And so we should be getting everyone's mics, the mic and cameras on in just a second. So the Crisis to Connection, an imperative for Black boys. Carlin, I'm going to have you join me. Deborah, you as well. Regina, would love to have you join as well. We know that this work just hasn't started. Carlin, you've been working with this group of individuals, I would say probably well over a year, to have these discussions and dig into the data as it relates to Black boys and the discrepancies that we're seeing in the education system, juvenile justice, child welfare. So when you started digging, what were your thoughts?
Well, initially we were challenged with the idea of what is your niche in the community? What sets the Children's Center apart? Other than having served children, youth, and families for over 90 years, who are you for the community? And so we were challenged, it will be 3 years soon, to to create a client profile, to determine who our primary client was. And that's when we gathered the data. And although many on this listening session, probably they're not surprised that they were African-American boys, I think what happened was we got the data, and with the data, you really cannot ignore the facts. So we're an organization that really does pride itself on providing a number of evidence-based practices. We have a strong, comprehensive array of services provided by very skilled and talented practitioners. And so it left us wondering, so what are we doing that's evidence-based or evidence-informed for Black boys? And we could not say that we were doing anything to meet the unique needs of this client population. So we began to dig in to figure out, okay, so what should we be doing? And what we found is, it's not as simple as being trauma informed. It's not as simple as an intervention, because so many other practitioners, systems, providers touch the life of a Black boy from the time of conception. So we realized we needed to address the issue of infant mortality, access to health care, early childhood school expulsions, like across the trajectory of across the lifespan of a child, and Black boy, so many others impact their lives. So how do we make sure that we can impact across the lifespan, and we can't do that alone? And that's where Crisis to Connection and Imperative for Our Black Boys was born.
Thank you, Carlin. One of the comments that has come in so far, and I'll just read that, and thank you to Dr. Dayton, who's joining us from Wayne State University. One way to support Black boys is to support and encourage involvement from their fathers. Beginning in pregnancy, when fathers are involved in the lives of children, children do better. Infant and maternal mortality and morbidity rates are dramatically lower, and children's social emotional development improves. Let's empower fathers to be involved and engaged in the lives of their children. And I don't think anyone on this panel would disagree with that comment.
Yes, the Children's Center has been involved in the discussion about including fathers in the life and care of their children for quite a while. And we do recognize that that's one of the misnomers we think in our community, is that fathers are absent. However, we think fathers are present, and that we as providers and community members need to do a better job of not just uplifting fathers and ensuring that they're present, that their presence is felt, but also that they're heard, and that we reduce any type of barriers that causes challenges for them to have access to be a part of their children's lives throughout their lifespan.
Just want to remind everyone, please, you're more than welcome to raise your hand. We can take your live questions, and we can also take questions from the chat. If you do have a live question, the only ask is that we keep it for about a minute max so that we can be mindful of everyone's time. For Carlin, George is back. Thank you, George. Glad to have you back. We know the weather is something else today. Just a question here. Currently, what is TCC? So we're starting this imperative. What work have we done already around this imperative, around the work with Black boys?
Well, this imperative, the discussion started with our staff. We started first when we were trying to determine who are we, or who should we be for our community? What is our niche? We included the employees of TCC in those beginning discussions, and we have included them along the way. We have worked to ensure that we're trauma informed in our practices, and we're really focused right now on ensuring that we're trauma informed across the board, from the time you hit the TCC campus to you walk out the back door, so to speak. And so our staff has been involved in what we have now as an implementation team. It is a team of individuals across the organization, across departments and levels that come together to develop this imperative. So not only do we have for example, we have our professional development department involved in looking at training, and we have our programs folks looking at capacity building. We have our equity, diversity, and inclusion committee looking at issues related to equity, diversity, inclusion internal to the organization. Those are just a few examples.
Those are a lot of great examples. I want to stay on the track of fatherhood, though. And George, you're back with us. There was a question now of how do we acknowledge or engage fathers at the Children's Center. So I'd like for you to handle that question.
Oh, thank you. And I apologize. I am experiencing internet. So I'm going to try and answer this question briefly before I lose connection again. Basically, one of the things that the Children's Center did years ago was really take a look at was our environment warm and welcoming for fathers? And what we did is really scanned our environment. And I can tell you personally, when I looked at our lobbies probably about 6 or 7 years ago, I truly saw pictures of kids, which was great because that's what Children's Center does, provide services for kids. And I looked at other photos and I saw moms and kids. And I said, wow, that resembles a family. So that's good. What was missing was fathers. And so we began to place pictures of fathers around and families around the campus. Because you see, if you want to engage fathers, you have to make them feel as though they're part of the process. So making sure your environment is father friendly. The other thing that you have to do is be intentional. It's clear if a mother and a father walk into a building to receive, whether it's a behavioral health services, a child welfare service, gambit, most times the fathers will take a seat or step back, depending on the culture, and the questions are directed truly at the mother. We have to be intentional and make sure that we engage in both parties and looking for what we can do for fathers. And although there's data out there that talks about, fathers are absent or there's a negative perception, you have to flip that. Because I tell you, whether that father is in the home or out of the home, generally speaking, that father has some type of impact in their child's life. Either that means that this is how they see a male to be, or they see a different version of a male. So really simply engaging the fathers. We do a lot of work intentionally working with our fathers at the Children's Center. We have a committee or initiative called our Mighty Men, where we look at socialization skills. We also run a 24/7 dad's curriculum to really address the needs of fathers. So it's really about getting fathers involved because they are important to helping kids be successful.
Thank you, George. And we know that many of our fathers, our families come in with their own trauma. There's a comment in the chat that speaks to the intergenerational trauma that the Black community has. And we know that to be true. And we know that trauma can be passed down from one generation to the next. And so having that fatherhood initiative specifically really helps to work to address that. And it is so important as we start to have these conversations about Black boys and trauma. So with that said, I'll take another, and Algeria, thank you for the question in regards to the comment around intergenerational trauma. Is TCC working on anything related to dismantling the stigma in the Black community with families regarding mental health? Part one of the question. If not, is there a way in which partners can assist these efforts so that we can help further meet the needs of mental health support, not only for the children, but for also the families?
I think that the Children's Center we have a number of efforts that we work in the community to destigmatize mental health, whether it's in our partnerships or in our work in the schools. We make efforts to do so. Our work with Youth United is another good example. Our work with the Wayne County Fatherhood Initiative is another good example. Is that enough? I don't think so. I think that this effort here will give us a much broader platform, because what becomes important is that you're involved in that discussion. So it's not, the mental health person. So for example, me, I've been a mental health practitioner for over 20 years. So when one of my family members come to me and I say, you should see a therapist, they roll their eyes and they're like, Carlin, I know you would say that because you're a therapist, right? So the mental health practitioners sounding the alarm about the importance of mental health sometimes isn't as effective as having the entire community embrace this idea of ensuring that we're all healthy, both physically and mentally. So this particular project is meant to ensure that we're all working together.
One thing I'll add to that, Carlin, is that the Children's Center has engaged in several anti-stigma campaigns over the past several years through our social media, through radio and print and website. And that's still not enough. It has to be ongoing. So this initiative will indeed raise that issue and create the platform for others to join in with us, because this is an issue, and we know in the Black community it's very strong that folks don't want to hear about that. You may know you have an uncle or a friend who needs help in terms of mental wellness, but people don't talk about it. They see it as shameful, and it should be no different than you're going to a physical doctor for the other things that we have to deal with physically. And that's what we want to do, to raise this issue broadly, so that Black boys, brown boys, whoever, understand that that's a part of caring for ourselves. That's a part of our wellness as a human being, and should not be anything that we're ashamed of.
And as you said, Deborah and Carlin, education and awareness is key, and it's going to take all of us. One of the things is, how do we make the conversation about mental health a normal conversation? The same way you have that conversation if you was sick or ill. But the truth of the matter is, when you're dealing with Black boys in our Black community, if you really say, if you express your emotions, you're wrong, because that's a sign of weakness. If you say you have to talk to someone and you have a mental health issue, it's considered to be a sign of weakness. But the flip to that is, it has to be a sign of strength, because it takes a courageous person to stand up and say, you know what, I can't do this alone. But it has to be a conversation that we're all having, and that conversation has to be intentional, and it's got to be normal dialogue that happens on a consistent basis.
Absolutely. And Kevin, I just wanted to give you an opportunity, and I'm going to take a couple of more questions from the chat. But NAMI Michigan is a huge partner of the Children's Center, and we partner together. Messages regarding anti-stigma is key. Carlin, Deborah, I think you mentioned that. But Kevin, the issues around trauma and the stigma and the effects on Black boys, this is something that NAMI Michigan does on a daily basis.
Yeah, and thank you for making that point, Laura. You know, obviously, stigma elimination is the key focus of NAMI. Is to eliminate the stigma associated with mental illness, so people will seek the help that they need. And you know, I have a very under-scientific terminology that I use to address this, because I'm asked the question all the time, what's the single most important thing we can do to reduce stigma? And it's talk about it. We have to normalize this conversation, and the way we do that is to talk about it to the point that people are comfortable having a dinner table conversation about it. Young men are comfortable, fathers are comfortable having a conversation when they're driving to and from baseball practice or the ball game with their kids. We need to normalize this conversation the way we normalize the conversation of breast cancer over the last 30, 40 years, the way we've normalized the conversation about the LGBTQ community. We have to push this agenda forward. There is no more waiting. People always say, well, when is our time? Now is our time. Yesterday was our time. Tomorrow is our time. Our time is now. And it's up to us collectively, collaboratively, to normalize this conversation so people aren't afraid of it anymore.
Absolutely. The time for fear around mental health, those are the days of old. As you said, Kevin, our mental health is just as important as the physical health. The conversations around trauma are so key that it does have to be a conversation. And that's why we're having this conversation today. That's why we're having this listening session, to bring forth the information and data collected over the course of more than a year, and really taking that stance to say, how can we bring systems together to make collective change? There's heavy lifting that's going to be going on, and that's why we have everyone here. I'm looking at the camera, and we have policymakers and folks from the courts and social work and community agencies and community action agencies. It will take everyone together to have this heavy lifting take place. I'll go back, and I just want to make sure. Oh, was someone saying something?
Laura, can I say a little more about that?
Sure, please, Regina.
I think when we talk about the heavy lifting, one of the primary reasons we have you here is because, like, we looked at the data ourselves for the Children's Center and looked at how we needed to change our practices and what we needed to do to become more of a driving force to allow Black boys to live their dreams. We have you here so that you can then look at your organizations. You could look at the places you have influence to say, what are the practices? What are the changes that need to be made? Because you are in the best position to say how things work and how things are limited or not working as well as we'd like them to. And so you're in this conversation because we need you to look where you are an expert, so that we can then come together to say, these are the changes that need to be made, and we can hold each other accountable for getting the actual heavy lifting done.
Thank you, Regina. It is key. It is so key. I'm going to go.
Just real briefly,
Sure,
one of the chat questions asked about how we're engaging some of our partners and providers that provide actually their preschool, Head Start, that kind of thing.
Yes.
And we have started many of those efforts, which Carlin can elaborate on. But again, that's something that has to be expanded, because you're right, that's where they're being over-disciplined. That's where things are occurring that lead to expulsion, suspensions, and that kind of thing. Carlin, we have an initiative with the preschools right now on early childhood. If you can just kind of take 30 seconds and mention that.
30 seconds, incredible beginnings. How's that?
Yes, we do just that. Partner with those organizations out there, and we're training their workforce, their teachers, how to deal with children that present with those issues. So we're doing bits and pieces, and this collaborative is about, let's bring all the folks to the table and determine how we can forge that systemic change that's needed in all pockets. So we're just not doing a little here and a little there, but it becomes really a systematic change for our Black boys.
Yes.
Can
And
I
Deborah
add-
and Carlin, oh, I'm sorry, George, if I could just add really quickly, we have a current relationship with several of the community partners, the early childhood partners, but more specifically, we are housed inside of the Focus Hope Early Childhood Center on Oakman. And our staff are embedded in that center, working with teachers, working with families, doing training, and providing therapeutic services so that we can do just that, work with educators and families so that we're not seeing children in preschool suspended. I think that's probably one of the most ludicrous things that you can hear, but it happens. Children in preschool and Black boys get suspended from school at higher rates, and that's why we're focusing. George, you were going to say something. I'll look over here at the chat for more questions.
Well, a real current incident that just happened involving the shooting of the adult male in Wisconsin. Here's the piece that no one's talking about. He had kids who literally saw the incident of the shooting, and they were Black boys. So when these Black boys act out, the first thing that's going to happen is we're going to presume that these are bad Black boys. But no one's going to go back and really talk about the trauma that they experienced from this particular incident. So it's really important that we begin to certainly educate and talk about, the trauma that impacts these kids, which leads into the negative behavior or the way in which they express themselves. So I think as we're talking about early interventions, and as we talk about normalizing the conversation, these are the conversations we can have right now. We're all in a situation now where, unfortunately, our ability to move freely about, to go from place to place is limited. We have our families connected to us. Now's a great time to start having those conversations about trauma, how things are impacting their lives and changing them. This is a great opportunity to talk about mental health services and ability to normalize these conversations.
George, it is. This is the time. The time is now. We've got to act. And everyone, because you're here today, tells us that you're ready to be activated. And so with that said, we have a lot of questions or have comments, and there's so many positive comments coming through. But I want to make sure we have due time, because there's a lot of questions around how do I get involved? I want to learn more. This is a short conversation to the larger conversation and that heavy work. So with that said, I want to be mindful of time and give Kevin Fisher, who has agreed to be the co-chair of this imperative. He has a lot on his plate, so he's picking up the ball. He's going to run with it. So Kevin, I'm going to pass this heavy ball off to you.
Thank you, Laura. Laura knew, and some tells me that Ms. Matthews and Carlin knew that if they had Laura ask me, I couldn't say no.
True.
But quite frankly, I am honored to be here. I'm honored to serve in any capacity because this is something that is near and dear to my heart. And I'm going to try to be brief, and maybe we can get a couple last minute questions in. I look, as we talk about, and as George so eloquently gave us the tale of two blocks, literally, not two cities, two blocks. I always go back and look at myself and I say, I'm not supposed to be here. I'm one of those kids in 48224 that he's describing. I grew up in Highland Park. I don't come from an affluent background. I don't come from educated parents. I am one of 9 kids. There was drama and trauma in my house. I was next to the baby. I lost my dad at 15. There was so many odds stacked against me. But I want to focus on one thing here because I've heard it several times today, and it's the word dreams. Our young Black boys need to have the opportunity to dream and to experience those dreams. And one of the things that I benefited from, I didn't travel much as a kid, but I was exposed to people. And I was exposed to people in a way that showed me that there was a way forward, that there was a life past 8 Mile, there was a life past Telegraph, that imaginary border that's, for some reason, our young African-American families and people and Black boys that we're talking about can't see beyond. This is not about clinical, well, I would say it this way. This isn't only about clinical work. Yes, we need to provide clinical services, but we need to find a way to allow these boys to dream. And we need to find a way to help their families allow them to dream. And if that means helping them, again, providing treatment, but it goes beyond, is dad employed? Is mom employed? You know, there's so many layers to this that we need to get to so people can see a life beyond the drama and trauma that they're currently experiencing. Because I can tell you, I've always been a dreamer, and the ability to dream has led me and provided me with so many opportunities. Above my shoulder is a picture of my son. And those of you who know me know that 10 years ago, I lost my son, Dominique, to suicide. And prior to that, 3 years prior, Dominique was diagnosed with serious mental illness. He was diagnosed bipolar schizophrenic, and it came as a complete surprise. Prior to that, and even when he was in the throes of his diagnosis, Dominique still maintained a good grade point average. He was I describe him as an all-American kid. One of the things that I'm most proud of in hindsight, and no parent should have to look at it this way, but having lost a son, one of the things I can look back and say is my son had a good life. I exposed him to good things. I took him to work with me. I took them on business trips with me. I coached Little League. I was engaged. And something I think Deja touched on in the chat before was the difference in absence fathers and disengaged fathers. I am a first-time grandfather. I have a 7-month-old grandson who I can't wait to get here this evening. But his father, this is his first child. And I remember sitting in the hospital talking to him, and I said, because he's scared. And I remember being scared when I first found out my wife was pregnant with our first child. And I said, embrace it, have fun with it, play with them, stay engaged. Like I said, do Little League, do all of those things, because we are the models for what our young kids are going to see. We are the models for what our African-American boys are going to see. And if they see dad being respectful to mom, if they see dad, being engaged, I guess I'll say it that way, then that's what they'll model. And then we can help them realize those dreams. I so much appreciate everybody's time on this call, and we can't thank you enough for making the time to be here today. I see some people I know that, I would be remiss if I didn't say hello to my good friend, Chief Robert Dunlap from the Wayne County Sheriff's Department, and he runs the Wayne County Jails. My good friend, Bob Sheehan. This collective, this initiative is going to take all of us. It really takes us back to the old saying, it takes a village. And in that, and as George commented on the trauma that young Black boys see, for example, with law enforcement, we should see law enforcement as an ally, not as something to run away from. And how do we do that? We expose them to law enforcement in a positive manner. We have the Chief Dunlaps and the AC Whites and people from the law enforcement community. We have the judges and lawyers involved, so they learn that the judicial system is not always your enemy, that the judicial system can be your friend. We need to change their lens, quite frankly. And that's what we're asking you to do. How are we going to do that? You're going to help us design that. That's why you're here. We don't have all the answers. That's why we asked you to come to the table. I'm going to bring every resource I have to bear. I'm going to bring law enforcement and judges and athletes and rappers and all of the people who I've come across that I think can help us influence this. I'm going to bring those resources to bear, and we're asking you to think outside the box and do the same thing. So what are we asking of you? We're asking you to commit to, first of all, I'm going to assume since you're on this call, you're already committed. So I'm going to jump off with that. But what we're asking you in terms of time is to commit to bi-monthly meetings. We're asking for a commitment that you, your organizations, and your constituency will engage in this imperative that will cause system and structural change. And ladies and gentlemen, let me assure you, I sit on a lot of committees, and those of you who know me know I hate sitting in meetings that produce nothing. This is not what this imperative is about. This is about action and making change. So please understand that we will respect your time, we value your time, and we're going to value your commitment, and we're going to produce change. We expect phases of actions that looks as the following. We're going to develop internal buy-in. We're going to develop an internal evaluation and assessment. We're going to develop a strategy together with you, including priorities and a plan, and then we'll implement that strategy, priorities, and plan. And then in addition to that, the result is a structural and systemic change. We want to make sure we produce change. We want to have a real impact in our communities. We will have regular reporting out on progress. We'll create collaborative and mutually accountable relationships with all stakeholders. And again, with the assumption that since you're on this call today, that you're going to continue on this journey with us, we're going to host a stakeholder call on October 20th from 12 to 2 p.m. And this event will lay out the TCC evaluation and data, share TCC strengths and gaps, share what we are doing to address those gaps, inform who is already on board as a stakeholder, and what we believe are the gaps in other systems. And then we will share why we are the experts on viable resources and leading this effort. And your presence here is because you are one of those key stakeholders that we've identified to execute a plan that delivers systemic change. So I think, how are we doing on time? We got 8 minutes.
Doing good, Kevin.
If there are any questions, I am not monitoring the chat room because I cannot multitask when I'm on these Zoom calls. So if there are any questions, Laura, do you want to take anything that's in the chat, or if people are raising their hand?
Yeah, we are doing well, and I want to thank everyone. There's chats going on, and hopefully everyone can see the conversations going on. We have Deborah answering, we have Carlin answering, and Kevin, it's outstanding because we have folks coming in already saying, hey, I'm in. And so I think now is really the conversation of, and you shared, what are the next steps? And that's so important. So Carlin, you may want to chime in too, if you don't mind, or George. Kevin mentioned it, but what do we want? What are some of our first steps? And Kevin started speaking to those first steps, and Regina, you as well. Where do we go from here? Where do we go from these conversations? And just mics might be off.
The next step is really, as Kevin indicated, We're going to have a Crisis to Connection Imperative Stakeholders kickoff Tuesday, October the 20th from 12 p.m. to 2 p.m. We're going to do that via Zoom. But importantly, as important that is, it's a matter of making sure that this is just not the first time of engaging or having that conversation. We should begin to have that conversation because, as Kevin mentioned, we really are not trying to have a group of stakeholders and people be involved just to go to another meeting. It's really about action, and it's about changing system and changing that narrative that's written for our Black boys.
No, George, I'm glad you reiterate. And I just want to overemphasize that this is just not meant to be another conversation. This is work, because the issues around trauma and mental health haven't popped up overnight, and implicit bias has not popped up, inequity has not popped up overnight. So we do have that hard and heavy lifting that needs to happen. I do want to remind everyone just to take a moment to look at the chat. There's a survey monkey that has been dropped in the chat, and I hope everyone can see that. If you can take the time, copy the link, and if you don't have time, we'll make sure to get it out to everyone to take the survey through Survey Monkey. It's going to give us some information in terms of this listening session and allow us to stay connected with you. So if you can do that, that would definitely help. If I'm missing anyone in terms of a live question, forgive me, feel free to turn on your mic. This is awesome. I think we have over 44 individuals on right now, both from the Children's Center, the community, the courts, community action agencies, as I said. So if I'm missing someone in terms of a live question.
There is a question that asks how will people get access to the October event? We will be sending that link to everyone on this call that responds in the Survey Monkey link that says you are committed to moving forward. And so then we will send that link out to everyone.
Thank you, Regina. It is a talent trying to. Oh, I'm sorry. Go ahead, Deborah.
I'm sorry, Laura, for interrupting, but something came to mind, and I want to make sure that everybody on the call understands that while this is called Crisis to Connection, an imperative for our Black boys, this is not a Black issue, meaning that the organizations and the people that we want involved are not just the organizations that are thought of as typical Black folks who work on Black issues. This is a community issue. This is an imperative for all of us. So please stress to those that you talk to that this is about the entire Detroit metropolitan community and beyond, the entire state. And I think we can build something here that will be able to be replicated throughout the nation. So it's time to really put some legs to some of the issues that many of us have been talking about and strategizing about for years, but clearly we're looking for all voices, all individuals of all colors and interests. So please don't limit just based on the name of this imperative. It's important to call it out the way it is though. So we're not backing down on that. And Kevin, please do go ahead and speak.
Yeah, you see me biting, trying to contain myself here. When I made the statement, it takes a village, I meant it takes all of us. Ladies and gentlemen, we're at a place in time right now in this country where we're seeking social justice and change. Unfortunately, I kind of liken the George Floyd killing to our generation's Bloody Sunday. This is not a Black issue. This is not a us against them issue. This is a us together issue. Everybody, in my mind, everybody benefits from equality. And
Yes.
that, at the end of the day, that's what we're trying to get to. Again, from my personal experience, I have been so blessed to work with Bob Sheehan. I think I mentioned his name earlier on the phone. The Bob Sheehans of the world, the Judge Milt Max of the world, the Supreme Court Justice Megan Kavanaugh. I don't know how I got here, you know, and that's the conversation that's the experience that we need these young Black boys to have, is 5-10 years from now, for them to be able to say, I'm somewhere I didn't think I could be. I have experiences that I'm able to dream. And that's where we have to get, and we all benefit from that. I plan to pull in Judge Edward Joseph from the Juvenile Mental Health Court, and you know, so many others. So, you know, Deborah, again, you're absolutely right. This is not a singular race thing. This is all of us together can achieve something really great together. And that's the systemic change that we seek here.
Right. Other questions or comments? We promised to only keep everyone an hour, and we know that this conversation can expand way beyond the hour. So we're right at the 4 o'clock hour. Want to be respectful of time. Couple of questions that came up again. Will I get information about the October stakeholders meeting? Yes. One way to do that is to please complete that Survey Monkey that will help capture the information and your interest. By completing the registration form today, we were able to capture emails, but please leave some more comments in that Survey Monkey. We can definitely capture information. Today was just kind of a teaser, so to speak, to really rally the troops and to get you excited, to pique your interest, and really to call to action. It's time we talk the talk, it's time to walk the walk. And so we have our chairs, Kevin Fisher, George Nguyen, who will be leading that march. And we want you to walk along this path with us. Kevin, George, any final words as we wrap up?
For me, really quickly, again, I'm assuming, and I'm going to thank you in advance for the work that we are all going to do together. If the results of the Survey Monkey comes back and somebody says they're not available to participate, I'm going to chase you until you submit. So you might as well just join us now. And we're going to make this fun. We keep using the term heavy lift. We're going to make this fun too. So please join us. Thank you.
I would just say and echo everything that Kevin said. You know, some people believe that we're not going to be able to defeat racism. We're not going to be able to defeat poverty, or we're not going to be able to address childhood trauma. I say we can, but only together. So it definitely takes a village. And I appreciate everyone attending and joining us together, and everyone out there who's committing to helping make a difference.
Regina, Deborah, Carlin, Kevin, Kelvin, George, everyone, thank you so much for your time in presenting to all of our stakeholders. Thank you for your time. An hour is just not enough, but stay tuned. October will be packed and chock full of information, and just be ready to join, be ready to work, put in the work.
Someone asked about a recording of this session, and I think we did record it, right, Laura?
We did record it, and this is the second of 2 sessions, and we are looking to have those sessions placed either on our website or with our YouTube channel, so we can work to get that information out as well so that it can be shared.
Laura, I just wanted to mention too that between now and October the 20th, we will be reaching out to stakeholders to engage you and to do a little preliminary work prior to the October 20th event.
Thank you, Kelvin. Absolutely. We have our charge. We're going to be, there's lots of communication going on. As Kevin said, we're going to be on you. All right. So with that said, everyone, thank you. I heard some thunderstorms over my head. Everyone be safe. Enjoy your weekend. Stay well.
Thank you. Talk soon.
Thank you.